What is stress?
See, now what happens is whenever our mind and body is in unison, it is acting, or it is whenever there is an acute stress or something, there is a cortisol which is released.
And does it also cause cancer?
Now, what happens when there is a lot of stress like this, one to one, where you are going through a lot of negative life events, or unable to resolve the issues, or you feel the burnout of it, then there is a pro-inflammatory activity which sets in. To say that type A personality is most of the time related to gastric cancer.
But are there certain vitamin deficiencies which could manifest itself like a stress disorder?
Or also in vitamin B12 and vitamin D is known. Being stress does not come into the diagnostic aspect.
When you have stress, how does it impact sexual health and relationships as a whole?
Men can have a premature ejaculation, women can come up with vaginismus, dyspareunia, and of course it impacts in a major time with the relationship.
Welcome to Oncoflix podcast. I am Dr. Lohit Reddy, consultant radiation oncologist at HCG Hospitals, Bangalore.
And I'm Dr. Kritika, consultant radiation oncologist at HCG and your co-host at Oncoflix podcast.
Today, we get into another important aspect, which is stress.
And we have with us our expert, Dr. Pavana, consultant psychiatrist at HCG and at Akshaya Medical Center. Welcome, madam.
Thank you, Dr. Lohit and Dr. Kritika, for having me here today for this podcast.
Thank you, ma'am. So, our topic of discussion today is stress. If you have to explain to the public, what is stress?
See, first we have to know that stress is nothing but a perceived threat. Whenever our body and mind thinks that there is something which is coming up, there is something which is not okay, it's a normal coping mechanism for our mind as well as our body. This we call it as a perceived threat, which is nothing but stress, as we call it in a layman language.
And what are the types of stress? And also, it's related to a lot of health conditions. And does it also cause cancer?
See, whenever we say it is stress, we have to notice that whenever there is an issue, our body reacts in certain way. It could be a positive stress or a negative stress. Why I call it as a positive stress is there is some productivity which comes out of it. That is, see, for example, a student is going for an exams where he has to be stressful, little bit of it for him to motivate to study and give a best performance. Or it could be a negative stress where you would want to board in a flight where you will just abort that or you cancel the flight because you're unable to do that. Your stress is so much so that your body is reacting, having a sympathetic activity where you have a palpitations, where you have kind of a jitteriness, where you feel like it is not going to happen. So which has a negative impact to your life. That is what we call as a negative stress. Yes. So for the other question, what you were asking that whether it has an impact on cancer, whether it can lead to cancer. There is no scientific evidence to say that stress directly causes cancer. Now, what happens when there is a lot of stress is we have that is a pro-inflammatory activity or the kind of body reacts in certain way. Now, what happens at this point of time is we have a different coping mechanisms to it. When we adapt negative coping mechanisms, that is an unhealthy coping mechanisms where you would want to relieve your stress, relieve your anxiety, block those kind of thoughts, you would get into cigarette smoking or a bad healthy eating habits or a carbohydrate craving where you binge eat, the lack of sleep, all those things will lead to onset of cancer. It could be one of the factors to it, but there is no direct correlation as such.
Is there a acute and chronic stress as well, madam? Which one do we really talk of when we are talking of cancer causation?
So, see, whenever there is a issue, we have an innate nature of like a fight and flight reaction. Something just comes very acutely. We react in certain way. Either we run away from the problems or we would try to resolve it. It's an acute. I miss my bus or an interview, or I have an interview scheduled, or I have a talk scheduled. All those things could be an acute stress. Now, when there is a chronic stress, it's a cumulative stress, one to one. You're unable to cope up with that and you feel the burnout of it. So that is where we call as a chronic stress, where it has a much more health impact rather than an acute stress. Acute stress is somewhere that, a body's way to react in certain way.
So, what are the mechanisms of stress causing cancer? If at all there is an association, at what level does it interfere or interact?
See, now what happens is whenever our mind and body is in unison, it is acting, or it is whenever there is an acute stress or something, there is a cortisol which is released. And whenever there is a cortisol which is released, there is an hypothalamo-pituitary activity which happens. Now, what happens when there is a lot of stress like this, one to one, where you are going through a lot of negative life events, or you're unable to resolve the issues, or you feel the burnout of it, then there is a pro-inflammatory activity which sets in.
So it's like reactive oxygen.
Yes, definitely. So that is where it leads to one of the factors to the cancer. It's nothing like, it has a direct correlation to it.
I think not just cancer, there's also like, stresses related to cardiac, okay, there are, other issues with respect to health as well. Cancer is probably one of the great aspects with respect to health, but there are multiple other health conditions which is related to stress as well.
Yes.
So, are there any specific personality types which are related to, specific cancers? So probably we heard about certain, type of personalities.
Yes, definitely. There are a lot of studies to say that type A personality is most of the time related to gastric cancer, or it could be type C personality, what we say like anxious avoidant personality, OCPD personality, obsessive personality, where there is a lot of anxiety, they are not able to deal with it. So these kind of an issue where there is a personality traits itself, it need not have to be a personality disorder per se, but personality traits of these kind of it, where there is a high functioning, they don't rest themselves, they don't know where to draw lines, there is no boundaries which is drawn, so they push their body and mind. So that is one of the factors which could contribute to the factors of the onset of
So
cancer.
how do you define this type A, B, and C personalities?
See, one is it's a high functioning personality. It could be a type A personality, or type B, where we call as a borderline personalities, or type C, where there is an anxious or obsessive compulsive personality traits. So according to, there are different classifications altogether according to the DSM-5 or ICD-10, international classificatory system, what we follow in Asian countries. So based on that is what we call as a different types of personalities.
Madam, we often think of stress as a mind issue, but are there certain vitamin deficiencies which could manifest itself like a stress disorder?
Yes. See, there are a lot of vitamin which is involved. See, basically, there are a lot of studies which we have a correlation to say that vitamin B12 or a vitamin D deficiency will lead to some amount of an anxiety. Now, to say, see, stress is not a diagnosis. It is just the body's way to react. It's a spectrum which comes in. Now, what happens when all this thing happens? There could be unhealthy eating habits, where could be loss of appetite or binge eating with a carbohydrate. Now, what happens is when you're not taking into a nutritious food, then there is a micronutrient which there is a deficiency, which also contribute. See, in our country, most of the time it is a nutritional deficiency where anemia is known to cause. There is also an anxiety symptoms which could mimic, like having a giddiness or a palpitations. All these things could mimic with an anemia, or also in vitamin B12 and vitamin D is a known cause of vitamin deficiency, which you most oftenly we see in patients.
So I think when you're talking about the dietary aspects, it's very important to understand that certain vitamins are considered to be antioxidants, and this would help us prevent cancer as well. So which specific vitamins are crucial with respect to antioxidants, and especially when there is stress, there's always going to be a lot of changes in your dietary habits as well, absorption capacity as well. What, according to you, are the dietary supplements or dietary vitamins which are absolutely important for reducing stress?
See, one is we have to consider it here is we are talking about stress. We also have to emphasize on a preventive aspect to it. Most of the time we always tend to speak about the diseases, about the disorder when the things has already happened. We already have acquired an anxiety or any amount of a stressful event. Now what happens is having a balance, like any other nutritional perspective, to having an adequate amount of a carbohydrate or a protein or having an green leafy vegetables. Now what happens with these is there are a large amount of tryptophan which is there. So what happens is the adequate amount of it gets converted into serotonin, and which is one of the neurotransmitters which is very important for the mood. We know what is called as a detox, dopamine diet, all these things which is really present in our diet in every day to day what we eat. So adequate amount of it is very important, and which is not present in a junk food.
So, a balanced diet will prevent vitamin deficiencies, which could lead to stress. And on the reverse, a stress-induced dietary habits could also lead to that vitamin deficiency, and ultimately, it's like a vicious cycle that happens.
Yes, see, there are also studies which has proven that there is a gut-brain related to that. Whenever a person is very anxious, now what happens is they would always come with we have seen even an IBS, inflammatory bowel syndrome, what we call, most of the time patients present with IBS symptoms like, having an indigestion issues or not able to digest food or an acute gastritis is one of the factor. So these are the people who most oftenly have issues with anxiety.
So I think microbiome is not just pertinent to cancer, and we talk in cancer about immunotherapy and immune systems pertinent to the microbiome, but I think microbiome of the gut forms a very important aspect in mental health as well.
Yes, definitely. See, most of the time we see into these symptoms. See, most of the time patients does not come with I have stress.
So
they come with symptoms.
So you mean to say even in stress, supplements like probiotics and prebiotics could help in reducing stress?
Yes, definitely. It is a part of your the management plan. How we address their stress, how we address their stressful, what are the stressors, how do you manage it? This is dietary and all these factors contributing to their management plan.
That's interesting. Madam, often these people who are stressed say that they're not able to sleep. And if they're not able to sleep, there is going to be a disruption in the circadian rhythm. Is there a possibility that that aspect of stress also could contribute to the increased cancer risk?
See, most of the time what happens is when we are talking about stress, it is stress is everywhere. You might have seen even a small child to a elderly person who is talking about the stress. We live in the world like that. Now, what happens once the patients or the clients come to us is they come with the symptoms like having an insomnia or a sleeping issues or having an anxiety, palpitations it could be, or a change in their mood, or unable to manage with their activity, efficiency is being decreased, or a fatigue, or the way they carry on with their work, there is some efficiency which has decreased, which they have noticed in their workplace. All these things is the symptoms which they come up. Now, most of the time what happens is whenever they come up with the sleep issues, they would have done something at their level of it. Like, changing their bedspread to having a sleep hygiene. Now, what happens is, now having a sleep disturbance is one of the big thing which we usually come across. Because most of the time they are got into Insta Reels or YouTube, mobile. So until they fall asleep, they would not shut off. So now you can realize that our circadian cycle is somewhere programmed in a way that as it is dark, our brain has to shut off.
Correct.
And then as it is 6 or 5, 6 in the morning, now again we are awake. So this is how usually our circadian cycle comes in. Now, what happens is when we are looking into our mobile or gadgets for longer hours, now through the retina, the light passes and there is a stimulation. Now, it's very confusing for the brain to stay shut off. It becomes more hyperactive. So we always recommend anyone after 7, you should take off your mobile, take off any kind of gadgets. You're unable to sleep, there is no place for gadgets. So this is has to be the mandate even for children or for any age group for them.
There has been a lot of talk, like for example, celebrities like Narayan Modi and L&T chairman talking about long working hours. So, this long working hours gives a lot of stress. There will be, interpersonal issues. There could be, family issues, which could, create a lot of impact on the overall health of a person. What is your take on this aspect?
See, one is we have to see here if it is a long working hours, no matter what it is. So we are a social being. We need our loved ones to be around. Most of the time, the trend of it is what I have seen is at 60 years of your age, you retire, you come back home. You're no more required for your profession or you're no more required for your job. Now, when they come back, the kids are all grown. You are a total stranger for your spouse. You don't know the dynamics of the house. Now, what happens is now you are at your elderly age, you're taking your time to adapt to it. And it is so unfortunate.
Correct.
Anything for that matter, anything with limitations is good. It is nothing about you work for 90 hours or you work for 100 hours or how productive are your workplace. But having a quality is very, very important. Your quality, your life. See, because health is the onus of every person. So you have to take responsibility of it. What is that which is required? Even at the workplace, they say you have to take a multiple breaks and then your efficiency increases. Go on a vacation, you come back. Now, what happens is the age of whatever things to be with the family or the youth seeing children grow up and all those things is gone at your 9 to 5 or 9 to long working hours of the job profile. Then it is, I think, somewhere we have to see, is it really worth?
Correct. Coming to doctors, ma'am, I think during your residency time, you sometimes have to work for 48 hours, especially in some departments like cardiology, anesthesia, when you're in high volume centers, you tend to be continuously working for 48 hours. I think, what do you have to say about it? And how do you manage stress in that kind of situation, especially pertinent to doctors?
So, in fact, long working hours and doctors working for night duties together, all this interferes with interpersonal relationship, your family timing, the food that they eat. It's not just in a constant state of stress, but sleep, food, every aspect of it gets affected.
See, we never talk about doctor stress. There are a lot of studies which says if a life expectancy of a common man is 78 to 80 years of age, it is doctor's life expectancy is 10 years less. And you can imagine the person who is, have to, as a healthcare provider, now you are not talking about it.
Correct.
That's very unfortunate. So I think somewhere, even not as an healthcare provider, you have to take care of the health. See, long working hours, if it is needed, so how it has to be streamlined, because we know the doctor ratio to the patient ratio in our country there is a wide gap. So somewhere all these things are the policies which needs to be changed so that we provide a conducive environment for both doctors as a profession and as a trainees. Now, because if we are not vigilant about all these things, it is the people who want to take as a medical as their profession. I think we would see slowly it will deteriorate.
In fact, in fact, it's a very interesting point, and a lot of conferences today are talking about provider wellness. So, what that means is, if the well-being of the provider is not there, how many errors it can lead to, and how efficiently are we managing our patients when you're in a state of wellness versus when you're not.
Yes, exactly. See, most of the time I see doctors who don't take care of themselves. They either go for a walk or they're busy with the OPDs and they're busy with the long working hours. All these things here, we are not just about seeing at the corporate aspect to it. We're an IT professional, but also we have to see even with the doctors. See, as I say, it's the boundaries only you can create it. You can know what is that which works for you. So, in that aspect, having a healthy diet and a sleep and your working hours is so very important, because to know also that there is an interpersonal relationship with your family, with your social setting is so very important.
Totally agree.
Yeah, is there a biomarker for detecting stress? Is there a blood test or anything? Or how does one detect themselves with stress, and how does a psychiatrist like you diagnose them with stress?
See, as I was mentioning, stress does not come into the diagnostic aspect. Now, what happens is any kind of a mental illness is a spectrum. Once you feel stressed, once you start feeling there is something which is not okay, I'm not able to handle these kind of an issues, there is a repair mechanisms. How we have a small injury and we have a healing to itself, and we the wound heals by itself. The same way we have something called as our own coping mechanisms. Like we go meet friends, or you go on a vacation, you come back, then you start working, or you try to resolve the issues. So these are the things. These are the things where it is you cannot manage it, then it comes up to the mental illness, where you start noticing that it is a depression or an anxiety or other neurotic or a psychiatric conditions as such. So we need to address whenever there is a stressful thing. If it is not managed, unable to manage, then we have to get into the professional help, or what can be done, either talking to a friend or talking to family members. Also, most of the time we have seen that somewhere it can fix things. But to say it is there any biomarker or anything? See, there is nothing called as an blood test to indicate, okay, you have a depression. It is only the signs and symptoms.
Cortisol levels, does that reflect, madam?
It only reflects the acute stress. It does not reflect whether you have any kind of a mental illness.
Okay.
Now, what happens is when we are diagnosing, yes, the patient is having a depression or an anxiety or anything like that, we say if your state of mind or your mood symptoms, like a pervasive low mood, where more than 2 weeks you're unable to feel that happiness in your life, where your state of mind is very low, that is where you say there is something which is not okay. You have to take a professional help. Or you feel that you're very happily doing things, what you were enjoying earlier. Now the same thing feels as a task, where you take longer hours or you don't enjoy whatever things are you're doing. So that is where we set in that you are getting from a stressful, from a burnout situation to the depressive perspective.
Perfect. So you're also an expert in sexual health. When you have stress, how does it impact sexual health and relationships as a whole?
See, there are a lot of sexual health is a very broad in a way that both men and women can have an impact to it. Men can have a premature ejaculation. They can come up with an erectile dysfunctions, or they can have an communication issues with their partners, or women can come up with vaginismus, dyspareunia. So it impacts the overall quality of their life. And of course, it impacts in a major time with the relationship.
So, madam, when we talk of stress and gender, women in general, we know women go through menstrual cycles. Women goes through different phases of their life where the priority of their life itself differs majorly. So, do women go through more stress than men? And this could be with respect to the hormonal changes, it could be with respect to the social responsibility also.
When we are talking about the gender issues here, we have seen, yes, studies have proven that women in the middle aged are more prone for mood disorders, like having a depression. So men usually, even there is no as such which a gender discrepancy, even there is an onset of an schizophrenia or a BPAD or anything like that. But definitely in a middle-aged women, we have seen a lot of them who come with the mood disorders. And also now we are seeing the trend of in a geriatric age group,
Okay.
where there are a lot of old age to come with the late onset depression or a late onset anxiety issues.
So what reason do they quote for that late onset depression, madam?
See, one is what we have seen is there is a very shorter social circle where they do not interact with each other, having a single spouse where they are they become single or there is no spouse for their as a companion. Then excessive screen time. So most of the time we have seen old aged, there is no interaction between the other members in the family members. They get on to this social media so much so that there is no human interaction.
Interesting.
So now what happens is we are seeing more of them coming with the mood issues.
Even in elderly, screen time is an issue.
Yes, definitely. Now
That's
it is,
interesting.
yes, we have seen a lot of clients who come in an elderly age group and 60s, 70s, where, they have an excessive mobile use.
So even in the elderly geriatric age population, the predominant stress is more, and depression could be more with respect to women than men.
Yes, it is. It is definitely,
More in
it
the
is more this thing. But what we have seen is disease outcome is better in women.
Oh, is it?
Yes.
And
So-
why do you say that?
See, because most of the time women have went out to that, they have a social circle or anything, and they speak out whatever their in their mind, and they have a interaction. They have other things which they can manage, like and they get engaged with the household activities. They get engaged with the in a geriatric age group. If you're asking, they get engaged with the bringing up their grandchildren. All those things are there, where the social circle is little bit better.
Bigger. Okay,
In a
bigger and
way.
better.
So they keep themselves occupied
Yes.
to not really think about the depression aspect,
Yes, yes.
stress aspect.
And see, depression is a neurobiological. It's a disorder. It is nothing like you have everything in your life. You should not be depressed. There is nothing correlation with how much wealthy you are or what are your resources. There is nothing to do with it. It is an endogenous. There is an endogenous depression, which we say there is a depletion in the serotonin in the brain, which acts on to the having a depressive
So
episode.
does stress lead to depression?
Yes, definitely. If it is not managed well, you
Well-
have an unhealthy coping skills, you feel burnt out again and again, you do not have a resource to manage it, and definitely it can lead to, kind of a depressive episodes.
Correct. Ma'am, is stress underreported in rural areas? Because probably in the urban scenario, the access to mental health experts are going to be available. But do you think in the rural setup, it is underreported, or probably is stress a lot lesser in the rural areas?
See, if we are stress and mental illness, there are two different things here.
Okay.
So, if we are talking about the stress, we all know, have witnessed that in an urban setup, stress level are too much. You are in a too much of a competitive world where you have to do a lot of things. Your quality of living or your lifestyle, everything contributes to all these things. So obviously there is a lot of stress level which is much more. When we are talking about the kind of a psychiatric illness perspective, so the depression, now what happens is in the rural side, what we have seen is one is access to the mental illness or mental health expert. It is not so good. So that is one of the thing where it could be underreported.
Underreported.
So, as a companion to a person who's stressed or because of stress has gone into depression, what should they be doing to help this person out, madam?
See, this is so very important because to have an insight over there is something which is not okay, it is very, very important. If as a companion or as a partner, one can recognize that, my partner is unable to handle certain things, having an open ears to listen is very, very important.
Right.
Because it's a closed family members or a close set of friends which we approach when things are not okay with us. That is why active listening is very important. But most of the time what we tend to do is we jump into giving them solutions. So that we always tell that is an absolutely no. Just listen to them. They just want to vent certain things. They would want to figure out how things can be fixed.
So you don't even have to tell them what has to be done.
Exactly. So now what happens is you do this, you do that, you do all these things as a resources, they would probably do it. It's not that it is not, they wouldn't have executed it. But only thing is having an open ears to all these things is very important. And if at all you think that professionally they are unable to handle it, so getting them into a professional help is very, very important.
So, from the mental health expert point of view, if you have to give some kind of suggestions, what are the strategies which can help a person mitigate stress and probably, some kind of a relaxation techniques or breathing techniques which you suggest to follow?
See, one is we have to always see that we have to manage things. Priorities is very, very important. One is prioritizing one's health is very important. Just 5 minutes of a breathing technique, what we call as a box breathing. That is at the count of 4, you inhale, hold, then breathe out through your mouth. It's at the count of 6. So this box breathing, when you start practicing every day 5 minutes, it's so much so beneficial that you know the state of calmness. One is having those kind of a relaxation. The second is moving around. Most of the time we live in a urban setting, a sedentary lifestyle where we are on the couch sitting most of the time in a chair and a table. So now what happens is you're not moving around. Now what happens if you're not moving around, your muscles are not activated, endorphins are not released, so which are unhappy hormones. So all these things will contribute to what is called as the kind of an cumulative stress. So moving around, having a healthy diet and sleeping well, and also meditating or a relaxation for 5 minutes, these are the simple things which should be done. Because most of the time we have seen clients who come and say, no, I close my eyes, I relax, meditation. You need not have to go to Himalaya to have a meditation. It's just 5 minutes of breathing, conscious breathing, mindful breathing of self would relieve so much of kind of a benefit for the health.
We also see that people who are stressed commonly, went out by crying. And does crying actually help cope up with stress?
See, it is one of the emotions. When you're sad, you cry. When you're happy, you laugh. So it's the way of expressing oneself.
And does endorphin release happens with respect to tears or when you shed it? Is that why that natural coping up mechanism?
See, one is we have to understand here when there is something which is not okay to us, venting out or crying is one way of saying that, putting out things. It is venting out. So if the stress, the crying or being teary is what is helping one person, yes, definitely it has to be done. Now, how does it have a benefit or it is? See, you are getting over with whatever things are. That is one way of it. The second is, then you will figure out what are the things which needs to be done to manage it. I would always say, if it is something like, on and off, there is a crying spells, on and off, there is something which is not okay. That is where it should be an alarm. That is where you should say that there is something which is not right.
Correct. Do you think in the modern medicine space, intentionally we ignore the role of spirituality in probably creating an impact with respect to mental illnesses?
See, mental health itself says that, it is not just, devoid of any illness. It is in social, it is a, spirituality, it is a physical health, mental health. Everything, every aspect has to be belonged. And we have a very wrong assumption that the spirituality, and we always try to correlate religion and spirituality. It is so very different.
Correct.
No matter what religion you believe in, spirituality is the introspection of whatever things you are doing. Whether it is a value based, you're doing it in the right way, or which makes you feel okay, which makes you feel contented. That is what you have to aspect into a spirituality.
So that's an integral part of your assessment.
Exactly. It has to be an integral part of it.
And when should one person, with respect to mental health, ask for help?
See, one is this is a very important question because most of the time we have a stigma, we have a taboo to seek for help, especially mental health professionals. Now we have to understand that if anything is interfering their day-to-day activities, unable to manage, or there is some biological functioning like in sleep, appetite, this is all impairing, or they are having a constant automatic negative thoughts, what we call that, everything is they are seeking into pessimistic way, or they are having a death wishes or a suicidal ideation, or they are having they are unable to manage, they are giving up their whatever the ambitions, or having an anhedonia where whatever previously they used to enjoy doing it, now they no more enjoy things, or they are getting into the substance use. All these things are indication that definitely they have to seek a mental health professional or any kind of an psychiatric or a psychological help.
Is there a timeline to what you're telling, madam, when you say that these are the symptoms? Is there a timeline beyond which?
Yes. See, whenever we have a mood symptoms of more than 2 weeks of time, that is where what we say is what we segregate into mild, moderate, and a severe depressive episode.
So it's 2 weeks.
Yes, 2 weeks. So if it is you're speaking about an anxiety, then it could be 1 month to 6 months, where you are able to, whenever in this given situations you are having a presentation, or whenever there is a perceived threat, you are having a palpitation, you feel like a sinking feeling, or zoning out, your academics performance is getting deteriorated. All these things are indications that they have to seek a professional
Help. Madam, often when we talk about seeking professional help, be it for anxiety or stress, the fear is that they will start me on some medication. It may be a calming pill or a sleeping pill, and I will never be able to come out of it. Is that true, madam?
No, definitely not. See, what happens is whenever there is a mild to moderate depressive episode, also studies have shown that cognitive behavior therapies, what we kind of include into that, almost has a same beneficial when they start with the medications. So it is nothing superior to it. That is point one. The second is whenever you're starting with the medications, these are called as an SSRIs, where it is called as a selective serotonin reuptake inhibitors. Okay. Where when you start with these kind of medications, serotonin, which is very much required for our mood stabilization, where which we think which it is very much required for us, that is always depleted. Now this medications will replenish, and it is only for a short period of time, which we usually start. It is not that you are for a lifetime you are with the medications. No. Usually for a mood, all these symptoms we do not start it. But there are several other medical, whether psychiatric conditions like a schizophrenia or BPAD, where yes, patients have to be on a longer period of time, but we have to see the quality of life of the client. It is not about the it is not about how many days or how many months these are medications are.
So for example, let's say of 100 patients that you're starting on a medication, let's say sleeping pill or a calming pill, to help them get over that phase, how many of them will be able to stop it of the 100?
See, it is the guidelines itself says that first episode when we are treating with the depressive episode, it is only the 9 months of period which we start with the medications. You can actually taper it and stop the medications. It is only thing is you have to enhance your coping skills, the way you handle stress, the way you handle your automatic negative thoughts. The once you master it, you don't require any medications for it. There is nothing called as a happy pill. I pop it and I'm very happy in my life. No, there is nothing like that.
Right.
Whenever you have any kind of an issues, definitely we need to start as early as fast as possible, because I'll tell you the treatment gap once the patient is diagnosing to start with the medications in our country, it is almost about 90%. Right. That is, it's a very huge. We come across the patients who come after many years, where right. They're unable to do anything, their all their quality of life is gone, so they are the productivity age is all gone. So now what happens is when you approach initially at the earlier stages, early treatment will always have a beneficial in weaning off with the medications.
Right. So in this 9 months, you put them on medication. You also help them cope up with their stress in other ways so that they're able to come out of that medication.
Yes, exactly.
Amazing.
Yeah.
with respect to extreme stressful environments and people who are put under extreme stress can become superhumans. Like, for example, very high net worth individuals, they will be put under extreme amount of stress. Do you think this extreme stress could probably make them superhumans?
See, I think it is individualized. Everyone cannot be a superhuman, it's not necessary. And everyone cannot be doing the same thing what another person is doing. So it depends upon the individuality, your limitations, you what is that your priorities in life. Is it really worth taking those kind of a risk or worth doing all those things is what we need to be streamlining. And definitely it is nothing like stress really kind of polishes you in a for a better human. No, it is nothing. There is no proven data or a proven science to prove that there is something which is stress and you are a better person. No, but what we were mentioning, any kind of a positive stress is always good. I would never deny it, but any amount of a negative stress, it is never going to be productive for a human.
If you have to give three takeaways from the mental health perspective, okay, what would it be?
See, most of the time I see clients who come and say, I think too much. Overthinking is an issue. If you feel that overthinking will solve the problem, no, definitely not. Okay, there is no point in thinking too much. Any issues for that matter, it has a stipulated time, it's stipulated things to be resolved. The second thing is keeping yourself calm is very important. So at least a minimum of 5 minutes of relaxation technique, breathing technique. So that is very, very important. We have to engage in it as early age as possible. So that needs to be done. And 30 minutes of minimum or 5 days in a week is a physical activity. No matter if it is a sports or any kind of a sports or as simple as a walking, that would be best.
Sure.
And the last one is having a sleep and diet. These are very, very important because most of the time we have been into this aspect that, I compromise on a sleep, it is okay. Now I'm super functioning. No, sleep is very, very important where your brain has to shut off and come back again with the new things. So this is very important.
I think stress has been a very simple topic, but it's a very distressing aspect and it's ignored aspect. And it's been a pleasure interacting with you and so much of knowledge gained. And thanks for taking time off your busy schedule and giving us, so much inputs regarding stress. Yes, thank you.
Thank you for making me part of this program.
Thank you, madam.